Good morning. This is Marlena Buchanan, faculty of the Henderson Community College Associate Degree Nursing Program. Today we are going to discuss the critical criteria for successfully passing the sterile dressing skill. And your critical criteria is on page 121. Prevent anything that's not sterile from coming in contact with that which is sterile. Prepare a sterile field. Maintain visual contact at all times so you cannot turn your back on it. Avoid reaching across the sterile field with unsterile objects because that will contaminate it. Put on your sterile gloves, avoiding contamination. During the dressing change itself, you're allowed 15 minutes. Use clean gloves to remove and discard soiled dressing. Assess the wound and the dressing for appearance, drain, and drainage. Use sterile technique, cleansing the wound from area of least to most contamination, which means clean to dirty. Your incision is considered the most clean. Use one swab for each stroke. Apply and secure dry sterile dressing, and finally documentation, which is not on your sheet, but you do need to do that. Okay, first I'm going to check my orders and the client. I have the right client. I have the order to change, do a dry dressing change on a patient who had an appendectomy open 2 days ago. So enter the room. Hello, Miss Daniel. How are you today? My name's Marlene. I'm your student nurse, and I'll be doing a sterile dressing change. I understand you had an appendectomy. Yes. Can you state your full name and your date of birth? And she does. Do you have any allergies? No. There is betadine in the kit that I will be using to cleanse the wound, and you have absolutely no allergic reaction to iodine, seafood. She says no. And your pain level is, on a scale 1 to 10, 0. Okay. Well, let me just check your site. I did wash my hands before I came in. I need to check to see what equipment I'll need to gather. Okay. So she has a 5x9 ABV pad, and she's got it secured with silk tape, and you say there's no discomfort, no problem with the skin. Okay. So you understand that I'm going to do a dressing change, correct? She says yes. Okay, ma'am, I will be right back. I have to gather my equipment. Thank you. You want to get a pair of gloves, a drape that goes underneath the patient to absorb any, not a drape but a pad, to absorb any drainage, sterile gloves, and your dressing kit, and return to the room. Okay, I'm back. How are you feeling? Okay, and I think I already had the bed raised up to proper height. Yes. Okay. Ma'am, I need to put this under your back. I'm going to have you help me here. Can I put your arm up like that? We have provided for privacy. So the curtains pull. Okay. If this was a wound inside the very center of her abdomen, you'd have to put this pad all the way across. But hers is on the right side. So could you lift your hips, please? Thank you. Okay, we've got that prepared. Okay. I'm going to wash my hands again and loosen the tape. And if you feel like there's any drainage that you might contaminate yourself with, then certainly put on gloves if you want to. Loosen the tape by pressing down on the skin, lifting up the tape at the same time so you're not pulling on skin and causing unnecessary discomfort. And how are you feeling, ma'am? She's fine. Let me know anytime during procedure if you have any discomfort, and I'll stop. Okay? Okay, she voices understanding. So, my tape is loosened from my gloves. Okay, I didn't open my kit, but I can do that now. Open it away from you. Always remember to open away from you first. Go in and get that. Get rid of your forceps. You do not need that for this skill. Do not reach your hand across that sterile field, or it's considered contamination. If you can think of it as a force field that you cannot violate, then you're better off. Okay, this is my biohazard bag for putting body fluids in. And put your hands down in it and get it open so it doesn't fall over on you and contaminate your bed and cause problems. Okay. So now I'm ready to take my dressing off, and the critical part of this is to describe the drainage on the dressing and describe the wound appearance. Okay, so just lift up, pull it all off at the same time, and keep it away from the patient. So don't turn the dressing towards her. Does that make sense? You want to just pull up like this, look at it, and you're looking for taco, the type of drainage, and it looks like it's a thin, watery. The amount, it's saturated about half of the 1 4x4. The color, it's sanguineous because it's red, and there is no odor that I can detect. Okay? You're going to dispose of that in your biohazard bag. You want to look at the appearance of the wound, describe it, which would be PRED. P for pain, she's not having any discomfort. R, is it red? Yes, there is some redness along the incision line with staples intact. Is there any edema? No. Any drainage? Yes, because we just described that. And the edges are well approximated, meaning they are pulled together well. There's no gapping or any problems with that. Okay, you're finished with that, so you can get rid of your gloves. Okay, and wash your hands because you'll have sanitizer right here because you don't want to turn your back on your sterile field. Okay, now you want to prepare your sterile field. So you reach in from the side, not across. The blue is against me, and this is Olay. So now you have a sterile field. This is sterile. You cannot reach across it. You can come in from the side, and I'll show you how to do that. Now you're ready to put on your gloves. You can do that at the bedside. She's very cooperative. I would recommend take your gloves out and discard this. Get it out of your way. Remember, it's a 1-inch on sterile around the edges of your field, whether it's your drape or your gloves. So you can straighten that out. Use your non-dominant hand to put on the dominant glove, okay? You're going to remember to grasp it along the edge like this, up, step back. I'm still keeping an eye on my incision and my sterile field. And let me find my thumb here. Whoops. All right, we're going to pretend that didn't rip. Then you reach down. Wait a minute. Keep your thumb out like this, like the hitchhiker, so that this does not contaminate. Step up and back, or you can think up and out. And find your thumb in here, if it's in here. There it is. And you can just pull down, but do not touch. Okay, now, this I'm pointing to, I can't touch it, is contaminated around the edges. Remember, 1 inch? So when you're doing your sterile dressing or you're in your sterile field, this is considered dirty, but you can't touch it. Okay, if you want to, you can take your elbows and just drop that on the floor to get it out of your way. That's up to you. Now, I'm going to reach around right here, pick up your iodine swabs, come back, and drop it in your field. Okay? Reach in and get your dressings, out, drop. Come around, get your ABD pad, come around, drop. Okay? Remembering that if I took it and dropped it in that 1-inch border, that's considered contaminated, okay? I don't need the tape right now. I want just my swab to cleanse the wound, my 4x4s to go on top, my ABD pad is last. Are you having any discomfort? And my hands are above my waist at all times, okay? So go right in, back out. 1 swab down the middle. You can roll it, or you can just like this, or you can just take a swab down. Discard. Now, you're not to cross this either, so you're going to have to go around to get to the other side. So it's kind of an exaggerated motion. Start at the top, go down, come around, discard. Now you're on the side by you, start at the top, go down, discard. You're finished with that. Now you're ready to cover your dressing. Now the whole time I have the sterile field, I have my my incision site, and I'm not turning my back. Now you go straight in, straight out. And remember, this side that goes against the patient's wound is not to touch your hand. Even though you're sterile, that needs to not touch your hand. It goes right on the incision. How you feeling? She's fine. Okay, in, out. The blue line is where your hands are. The inside goes against the patient. Now, you've covered your sterile field. You're done with that. You can take your gloves off and you can secure with tape. okay? So grasp right in the middle. I know I have a hole in these. Grasp skin to skin. And discard. Okay, now we're ready to tape. How are you feeling? She's fine. Best dressing she's ever had. Okay, now you're going to go across, not up and down. If you do up and down, when she goes to stand up, it's not going to work very well. Do not cover the entire dressing with tape, or you will cause problems with circulation to the wound bed, and it's not going to heal well. You just want just enough tape to secure the dressing so it doesn't fall off. Next, okay, what I would do next is I would wash my hands with sanitizer, get a Sharpie out, and put your date and your initials and your time at the top of the dressing on the silk tape, okay? So that people know when was the last time it was changed. Okay, how are you feeling? She's fine. Okay, now you're going to say that you will discard your equipment, cover your patient back up, make sure you put the bed back in the low position, and make sure that she has her call light, and she does. Is there anything you need right now, ma'am? She says no. So next, I have to go document. And we'll have samples of those for you to see.